Hello doctors, do you feel so difficult brachial plexus? These branches, joints and then these are the terminal branches. How should we remember that? So, you should remember the mnemonics for these that are T, D, C, T. Start from R, T, D, C, T. R for roots, T for trunks, D for divisions, C for cords, and T for terminal nerves. R, T, D, C, T. Let's see the theory of the brachial plexus. Brachial plexus is nerve plexus that derived from ventral primary rami of lower cervical spinal nerves C5 to C8 and T1. Let's see the components of brachial plexus. It consists of following components. I have already told mnemonic R, T, D, C, T. Roots, trunks, division, cords and branches. How these form? Let's see. The roots, ventral primary rami of C5 to C8 and T1 nerves. C5, C6, C7, C8 and T1. Let's see the trunks. 3 trunks derived from roots, upper, middle and lower by joining these nerves. Next, the divisions. Each trunk divided into anterior and posterior divisions. These 3 trunks each divide into anterior and posterior divisions. Next, the cords. Division join to form 3 cords, medial, lateral and posterior. And branches, various nerves arise from each cord, like radial nerve, musculocutaneous nerve, ulnar nerve, etc. First, we will see in detail roots. These are constituted by ventral primary rami of spinal nerve C5 to C8 and T1, with occasional contribution from ventral primary rami of C4 and T2. In some cases, occasionally C4 can be included in these roots, and sometimes T2 also constituted in these roots. Origin of plexus may shift by one segment either upward or downward, resulting in prefixed or postfixed plexus. If C4 to C8, this will be roots, then it is the prefixed plexus, and if it will be C6 to T2, then it will be postfixed plexus. Then we will talk about the trunks. Roots of the brachial plexus join to form 3 trunks. Upper trunk formed by joining C5 and C6 roots, middle trunk as continuation of C7 root, and lower trunk formed by joining C8 and T1 roots. Trunks lie deep in the neck between scalenus anterior and scalenus medius muscle. We will again discuss through diagram. Then we will see the division R, T, D. Each trunk means there are 3 trunks divided into ventral and dorsal divisions, which ultimately supply the anterior and posterior aspect of limb. So, cords. Division join to form 3 cords. Lateral cord formed by union of ventral divisions of the upper and middle trunks. Medial cord is formed by ventral division of lower trunk, and the posterior cord is formed by union of dorsal divisions of all 3 trunks. Remember, in lateral cord, 2 divisions are joined. Medial cord is only 1 division, and posterior cord formed by union of dorsal division of 3 trunks. Here 2 trunks, here only 1, and here 3 trunks in the posterior cord. Let's see the branches. Branches arises from the roots. These are the first nerves to serratus anterior, means the long thoracic nerve. This is the root value, that's C5, C6, C7. Nerve to rhomboids. means the dorsal scapular nerve arises from C5. Branches of longus colli and scalene muscles C5 to C8 is the root value, and branched phrenic nerve arises from C4. Then the branches of trunk. Only from upper trunk there are the two branches, that suprascapular nerve and nerve to subclavius. So only from upper trunk, then the root value C5 and C6. Branches of cords. Lateral cord contains these three. Mnemonic is LML. Lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. And this is the root value C5 to C7. Medial cord, that is the mnemonic is M4U. M is 4 times. First is medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and medial root of median nerve, and finally U is for ulnar nerve. You should remember the diagram. You can easily write the root values of the nerves. Then the posterior cord. Upper subscapular nerve, nerve to latissimus dorsi, lower subscapular nerve, axillary nerve, and radial nerve. Remember, radial nerve formed by all the roots from the brachial plexus, means its root value is C5 to C8 and T1. So it's formed from all the roots from the brachial plexus. It is the biggest nerve in the brachial plexus. And for branches of posterior cord, there is mnemonic that ulnar. And remember, in the ulnar mnemonic, there is no ulnar nerve. Here is axillary nerve and radial nerve. Ulnar nerve present from the medial cord. Next, blood supply. Vertebral artery, thyrocervical trunk with branches, suprascapular nerve, and transverse cervical arteries. Then we will see important questions from the brachial plexus, that the clinical anatomy. First one is the Erb's palsy or the Erb's paralysis. It is caused by injury of upper trunk of brachial plexus. Here this is the site of injury. It is the root C5 and C6, and here is joint, and here are the two branches of the C5 and C6 upper trunk. Already we have seen, and here is the point that 6 nerves are joined here, that is Erb's point. 6 nerves meet here. Nerve roots involve mainly C5 and partly C6, mainly involved C5. Causes of injury: undue separation of head from the shoulder. When it will occur? When birth injury, difficult childbirth, fall on shoulder, during anesthesia. Deformity of the position of limb. It causes the deformity in the position of the limbs, that the arm hangs by the side and is adducted and medially rotated. So it's like the tip hand of police, like waiter stiff hand or porter stiff hand, also called as, means the forearm is extended and pronated. You can see your extend your arm and pronate your arm, like it form as the policeman's stiff hand. Then we will talk about the disability caused by the Erb's palsy. Following movements are lost. Which movements? Abduction and lateral rotation of arm at the shoulder joint. You already see that it arm hangs by the side and adducted and medially rotated. So abduction and lateral rotation can't occur. Flexion supination is not occur because pronated forearm is there. and biceps and supinator jerks are lost. Sensations are lost over small area over the lower part of the deltoid muscle. Then second clinical anatomy is also so important that Klumpke's anatomy. Klumpke's paralysis. Injury of the lower trunk of the brachial plexus causing paralysis of hand muscles. Earth paralysis is the injury of the upper trunk and here is the lower trunk. Site of injury is the lower trunk of the brachial plexus. Cause of the injury: undue abduction of the arm, as in clenching something with the hands after fall from the height or sometimes in the birth injury. And the nerve roots are involved, that T1 mainly but partly C8. Muscles paralyzed. Here, muscles of the hands are mainly paralyzed, that the intrinsic muscles of hand, ulnar flexor of wrist and fingers, that's mainly T1 and partly C8. Deformity and position of hand. Claw hand due to unopposed action of long flexors and extensors of the fingers. Claw-like hand is occur. In the claw hand, there is hyperextension at the metacarpopharyngeal joints and flexion at interphalangeal joints. You can do with yourself your hand hyperextension of metacarpopharyngeal joint first and then flexion at the interphalangeal joints. There is like bird's claw like hand. It is the disability. Complete claw hand, cutaneous anesthesia and analgesia in narrow zone along the ulnar border of forearm and hand. And also the Hornell syndrome. If T1 is injured, proximal to white ramus communicates to first thoracic sympathetic ganglion and ptosis. Vasomotor changes, that skin area with sensory loss, and tropic changes with long standing case of paralysis, dry and scaly skin. Injury to nerve of bell. It is the third, that is the serratus anterior. Nerve of the bell is also called as the serratus anterior, that causes the winging of scapula. This is the final diagram of the brachial plexus. These are the roots C5, C6, C7, C8, and here is the next we will see the trunks. Here form C5 to C6, C7 and C8 to T1. Here is superior trunk, middle trunk and inferior trunk. In the trunks there is only upper trunk have two branches, suprascapular nerve and nerve to subclavius muscle. Then we will see the divisions: anterior and posterior, and these anterior and posterior. Here is the cords. Here is posterior cord, lateral cord and medial cord, and these are the branches. Radial nerve is the branch of the posterior cord. Medial and musculocutaneous nerves are the branches of lateral cord, and ulnar nerve is the branch of the medial cord. If you like it, share, like and subscribe and comment for next topic. Thank you.